conversation at the end. So welcome everyone. My name is Rachel Cohen. I'm the CEO of Aging Dynamics consulting firm, and we focus on healthy and age-friendly communities through strategy, community engagement, and facilitation. And I'm also here as the executive director of Linkages, which is an intergenerational initiative that's committed to addressing social isolation through creating opportunities for meaningful intergenerational connections. And I just want to thank all of you for being with us today. I'm going to share my screen briefly and just kind of walk us through what we're going to be doing together today. If you're here for the age-friendly through an intergenerational lens webinar, you are in the right spot. If you're here for another topic, feel free to stay. Today we are focusing, this is the second in a webinar series, all focused on age-friendly communities. This particular one is on the how. So if you were here for our first one, it was more of a general overview of age-friendly communities, and we will put the link to that in the chat here in a bit. But today we want to focus on how do we actually do all of this? How do we create and sustain a community where all people thrive? So our focus today is on the how. And this is why we want to have plenty of time for conversation, because we know that there can be challenges, there can be all sorts of barriers, and this is a good time. We have a lot of great people here to speak. We have a lot of experts, even those who aren't speaking. I can consider all of you experts, where we want to have some time to problem solve together as well. So to give you just a quick overview of sort of some of our hospitality pieces and our agenda today, first and foremost, please use the chat. I know that like I said, we're going to have a number of speakers, but we really want to hear from all of you. So if you have questions, if someone says something that just really, really resonates with you, or that you disagree with, it could be anything, please put it into the chat. We are going to be monitoring the chat, particularly for questions, for anything else that, that we're able to respond to, whether it's while we're in the midst of speakers or at the end when we've reserved about 20 to 25 minutes for discussion. So please actively use that. The other tool that we're going to be using today is a Jamboard. And so I'm putting in the chat the link to it. And I'm going to ask everybody to click on it. And we're going to, what this does, and I can see everybody popping in right now. This is essentially a virtual whiteboard. And you can see the first two slides. If you look at the very top, just to orient you, there's something that says 1/5 and a rectangle. The first three slides are from our first webinar, and I invite you to add to them. We're just very curious about how people define age-friendly. We're going to give you a little information on that here in a second, but we really want to hear your input. The way to add to a Jamboard, super simple. If you look on the left-hand side, you'll see a vertical oblong shape that has a bunch of different emojis in it, essentially. If you go to the fourth one, it's a sticky note. You click on it, it pops up the sticky note, and you type in it. And then you just hit save, and it will put it on the board. Super simple. For our meeting today, add to the first three as much as you want, and then look at number 4 and number 5. That's where you click at the top. And this is where we want to hear about barriers. Any barriers you have, any challenges you've experienced, and you can add to this throughout the whole webinar. The 5th one is, are there resources or tools that you would like to have available to you to assist as you're continuing to work on your own age-friendly initiatives? Our intention is to continue with this educational series, and we want to make it really pertinent to what you all are working on. So I invite you throughout the webinar to use the chat, use the Jamboard, use all your tools to communicate, because we really want to hear from all of you. Now, what are you going to hear from us? So we are going to start off. I'm going to give it a very short little intro here in a second. And then we're going to hear from Jarrett Hughes, who is with the state. He's going to share with us a state perspective in Colorado on age-friendly initiatives. And then we'll be moving into a panel discussion with 3 county commissioners from across the state of Colorado, all who are engaged with age-friendly initiatives and our Commission on Aging, newly reestablished State Commission on Aging. Following that panel, we'll watch a short video from Carbondale and hear more about their age-friendly efforts. And then we have 2 sets of speakers, one from Larimer County. So our friends at the Partnership for an Age-Friendly Communities are going to be sharing with us about a mobility assessment tool that they created and utilized, which is a wonderful example of, if I could ask everybody just to mute when you get on, that'd be great. The mobility assessment tool is a really wonderful example of how we create opportunities for intergenerational connections while focusing on our own communities. How can we do that in a very natural and organic and easy way? And then we're going to hear from our friends in public health in Chaffee County about their efforts to create intergenerational connections through housing and technology, and what they've done during COVID to really jumpstart their age-friendly initiative efforts. And then after that, it's all you guys. We want to hear from you. We want to have a robust discussion, any challenges, questions, any of that. That's going to be the time to really leap in. So as promised, my very quick overview. With age-friendly initiatives, we often have the basic question of what is age-friendly? I do a lot of work with a variety of different counties and regions and cities creating age-friendly action plans. And one of the very first things we do is talk about how are we defining this? Everybody looks at it just a little bit differently. And oftentimes what I find is that there are age-friendly initiatives happening, but people don't necessarily identify themselves as being part of it. So in this case, we're going to look at the World Health Organization's definition, which is that age-friendly environments are foster health and well-being and the participation of people as they age. So the phrase that I use with my clients is a place to grow up and grow older. So looking at that age inclusivity and really creating opportunities for us to ask questions about whether various elements of our communities are accessible, are they equitable, are they safe, are they supportive for a variety of different types of activities. So that can look like everything from built environment with parks and housing and transportation to our community spaces, places and programs in which we create opportunities to engage and meet with each other. That could be festivals, that could be voter registration drives, that could be anything and everything that's part of the character of our communities. In this case too, we have to define the word community. And here we're using it very broadly. A community could be a geographic area with actual physical boundaries. It can also be a social community, an affinity community. It could be a school community. It could really vary. And so when you're doing work in your own areas, it's important to also ask those questions of how are we defining community? One of the key pieces with age-friendly initiatives is that we often start off by making a declaration, which is how it works here in Colorado as well in many other states. We declare that our county or our city or our town, village is going to be age-friendly. Then we have to do the planning, which what I'm showing you here is just a quick summary of Jefferson County, Colorado's age-friendly action plan. And I show this to you as an example of we don't have to do everything all at once. And so in Jefferson County, the choice was made to focus in 4 areas, as opposed to sometimes many people will focus on all 8 areas, 10 areas. It can be really overwhelming. And it's one of the reasons that we wanted to do this particular webinar was to say, let's break this down into small bite-sized pieces. That's what our speakers are going to focus on, making it really realistic and available for everyone to be able to get engaged. Now, the other thing I have to define for you is intergenerational, because this, again, every word, we can all perceive it as having a different definition. So in the linkages initiative, the way that we reference intergenerational is that it's about mutuality of connections. So oftentimes we will talk about intergenerational as older adults serving youth, providing their wisdom, or it could be that youth are serving older adults. In this case, what we are saying is that there is a mutuality that actually exists in meaningful intergenerational connections where both parties, both ages, or it could be 3 or 4 different generations, they all bring something. They bring value and experience and expertise. It does not matter if you are 2 years old or you are 102 years old, you have something to add. And that's part of the magic of the intergenerational connections. The other reason why we're focusing on intergenerational lens for age-friendly communities is that there's tremendous amount of benefits and value, not only for the individuals, as you can see on this slide, for youth, it can be increased empathy, it could be improvement in academic performance. For older adults, it could be a greater sense of purpose and enhanced quality of life. But in this conversation, we're very much focused on that community impact. And so that is where our communities become much more vibrant and strong because people feel socially connected. We're able to interact. If we're at community centers, we are able to talk to that older person or talk to that younger person. It becomes much more natural to have those kinds of connections form, which is how our communities are stronger. And finally, the how. And this is what we're really diving into today. Really creating and sustaining age-friendly communities does require collaboration. It's the we all know it as a buzzword, right? Many funders require that. But in reality, we have to have this in order to make age-friendly communities a reality. And when we say collaboration, we're talking about it across sectors. So that's healthcare and housing, that is community development, that's social services, that's all of the different sectors have to be able to talk to each other and support each other in these initiatives. And it's also different stakeholders. And so when I say that, I'm also talking about different types of organizations and individuals. So our community-based organizations or our nonprofits, our businesses, elected officials, government entities, and our community residents who may not be affiliated with any of those formal organizations. It's all of us together. There's also an intentionality that we have to commit to when it comes to that intergenerational engagement. So it's not enough to have a room full of people of a variety of ages. That we can call that multi-generational, but if it's truly intergenerational, we've set that space. We've made sure that whatever programming we're doing is engaging for all ages. We're making sure it's accessible. We're making sure that we have prepared various language and our participants to know how to talk to each other and communicate, to address ageism that's going to come up from a variety of different directions. It just requires that intentionality. And it also takes creativity. So there's really big behemoths when you talk about age-friendly, like housing and transportation, very expensive. And honestly, those become some of the biggest barriers. We can't do it, we don't have the money. Creativity, and we're going to hear about this with Chaffee County with their home sharing program, the example from Larimer County with the mobility assessment. They're not coming in and saying we're creating a whole new, transportation system. They're saying, let's look at our built environment. What can we change? What are the small things? How can we assess it as a group? And then the last piece is patience. Some of this takes time and it takes energy and it takes a lot of education. Similar to what we're doing today is we all need to recognize what are these elements and how are we already part of it and how can we do more? And that takes a little bit of patience to get there. Okay. I'm going to stop sharing my screen. And with that, I am going to hand this over to Jarrett and our county commissioners. And we're going to hear from our elected officials to kind of kick off. What is their role? How have they been involved in these efforts?
Thanks, Rachel. Hi, everybody. I'm Jarrett Hughes. I'm here with the governor's office. I'm a senior policy advisor and I handle our aging and older adult specific portfolio. And I want to just kind of capture, I think, two of the words that I heard Rachel saying there at the end there. And the first being intentionality and bringing kind of a strategic focus to this work and intentionally focusing at the local level. The state, we are very much the middle mile of this process. We are kind of stuck between the federal government and local government and nonprofits in the private sector at the local level that truly drive home change and truly make impacts at that local level. We want to be supportive partners and subject matter experts where we can. I think Rachel has a wealth of knowledge. I want to be a resource. I know many of the other folks you'll hear from today have just excellent experience that can be tapped into as we look to kind of expand this work across Colorado, because the age-friendly livable community work is really an intentional, fundamental part of our local government strategy to support older Coloradans as our demographics change. And the only other thing I will add there is Rachel talked a little bit about patience. And all this takes time, and it's often difficult to make sense of kind of work that is so nebulous and intersectional and can be so seemingly difficult to wrap your arms around. But I think that little bit of the comment that she made around Jefferson County's work and focusing on the pieces that seem most relevant, most important to your communities is really integral to taking that first step forward. But livable community work is an excellent organizing tool. And so with that, I will kind of stop, and I want to introduce three of our county commissioners who are here with us today. So we have Commissioner John Kofalis from Larimer County, representing District 1, which is the northern part of Larimer. This encompasses Fort Collins, where he lives, LaPorte, Wellington, Waverly, Red Feather Lakes, Livermore, Buckeye, and the surrounding areas. He assumed that office in 2019. And prior to that was served in the state Senate, representing Senate District 14, and also served in the state House, representing House District 52. When he wasn't too busy with all of that, he was adjuncting at CSU. So very happy to have Commissioner Kofalis with here today. He's been a great leader in this work for years and years and years. And I know that when I was with the Strategic Action Planning Group on Aging, we relied on his help greatly. So thank you, Commissioner. I also want to introduce Commissioner Steve Child, who Steve represents Pitkin County. Steve is 74 years old and likes to spend time with his 3 kids and his 1 3-month-old, very talkative granddaughter when he has a chance to go to Fairbanks, Alaska. I was able to see Steve this past Friday, and I know he's going up there soon. So I'm happy to hear that. Steve also was an appointee in the county commissioner designation to the Strategic Action Planning Group on Aging for its entire 7-year existence. And so Steve is a wealth of knowledge, not only through all the planning group's work, but also has been a partner in Pitkin County. And because of the layout of the Roaring Fork Valley, Pitkin, Eagle, Garfield often work together in a very regional approach. Steve's a retired school teacher, bus driver, and a semi-retired rancher. And lastly, I want to introduce Commissioner Lynn Thompson. Lynn is 71 years young and on the 2nd year of a 4-year term with Saguache County. Lynn works part-time as a ward clerk at the emergency room, the Rio Grande Hospital, and she is on the South Central Colorado Seniors Board, Area Agency on Aging. She lives in the country with several 4-legged children consisting of dogs, 1 horse, and 1 donkey. And when she has the free time, she likes to ride her horse. Lynn is also a recent appointee to our newly reformed Colorado Commission on Aging. And Lynn, I know I'm looking forward to being able to coordinate with you and bring that rural focus and have you as our county commissioner designee. So I want to thank you all for joining us today. I think the first, I want to start off with a question to Commissioner Kofalis. And I think part of what we want to capture today is the why is it important that local elected officials work with their colleagues in ways that acknowledge Colorado's shifting demographics and our growing aging population, and what issues are you most interested in focusing on in your district?
Great. Thank you, Jared. Thanks to all who are participating. So in response to the question, at the county level, I would consider my colleagues and all the various public and private sector partners that we work with on issues that affect older adults. And of course, that's critical in terms of various initiatives that the county is undertaking in partnership with groups like the Partnership for Age-Friendly Communities and others. It's obviously important for commissioners to demonstrate leadership, to be listening to folks on the ground, to stay connected, and establish these as priorities as far as the various initiatives that the county is undertaking. So that's really critical. I think it's an important part of the job description of being a county commissioner. And as far as with my fellow commissioners that, certainly from Saguache County and Pitkin County and others, it's important that we collaborate and work together to share best practices and learn from one another and create that synergy at the state level. So that would be, I would offer that. And I won't get into the specific things that we're doing in the county until later on, but I hope that answers your question, Gareth.
Yeah, thank you, Commissioner Kofalas. And Commissioner Child, I want to turn to you. Could you talk a little bit about why you initially wanted to join the Strategic Action Planning Group on Aging and the impact that you think that the work that we are doing and through that, and then also as we move forward with our next steps, how local elected officials can kind of channel some of that and be a leader for change within their communities?
You're on mute, Steve. Unmute, please.
Okay, that will be better. You would think after a few years of this, we would learn that. So when I first applied for SAPCA, I'd already been a commissioner for several years. And you realize pretty quickly in an elected position, you don't accomplish anything unless you go to meetings and you have to work with other people and come to a consensus or to a majority vote to move anything forward. So when SAPCA was being created, because I was an older American already at that time, I thought this was a good place for me to be. I was already serving as our county commissioner representative for our senior council here in Pitkin County. And it was just a good way for me to get involved on a state level. I had already been involved working at Colorado counties where their commissioners from all across the state get together and we would work on forwarding legislation that would help maybe help all of the counties in the state or help one area of the state. So to me, participating in SAPCA was a logical way to work with people from all across the state on aging issues. Jarrett, you had a second part of the question. Could you repeat it?
I think as we've kind of transitioned now and the planning group has sunset and we're moving forward kind of towards implementation through this new Colorado Commission on Aging, can you talk a little bit about how, as a county commissioner, you can be kind of an agent and sponsor of that, thinking about ways we could leverage CCI, for example, kind of how does one go ahead and do that?
Well, certainly, and the new CCOA, of course, is really kind of a combination of the old Colorado Commission on Aging merged with the Strategic Action Planning Group on Aging, and the way the board is formulated and where the different areas of expertise and areas of the state that people live in are all represented on there. So this just points out to me the need to have collaboration across all parts of the state. Oftentimes on SAPCA meetings, it was kind of Front Range centric because most of our members were from the Front Range, where 80% of the population of the state lives along the Front Range counties. Well, the rural parts of the state encompass most of the landmass of the state and only 20% of the population. So the new CCOA has representation from all across the state. And I think that's important. moving forward, of course, just the collaboration between different elected officials and different staff members from the counties who work in human services and the aging area. That collaboration with people from other counties on a regional level and the area agencies on aging, and also on a statewide level through the efforts of the new CCOA, I think are critical for moving forward.
Thank you, Steve. And Commissioner Thompson, I want to turn to you and ask you kind of a general question as well. Thinking about the role of elected officials, can you speak a little bit to why, what drew you to the work through your area agency on aging, and kind of some of the efforts that you're hoping to support or drive forward in Saguache County?
Thank you. Saguache County is really very rural, and we do have a senior center in the town of Saguache, and I didn't realize it isn't considered a senior center. So we don't get a lot of the funding that the other counties do with their senior centers. We're in the process of building a new one outside of Saguache, and I'm really excited about that. That may qualify us for that. But the biggest issue we have in Saguache County is a lot of seniors are living out in the rural areas, and they're not living up to the planning commission codes. They're living in campers. They don't have septic. And it's just a nightmare trying to get all these agencies to try to help them. And of course, they're stubborn. They don't want to move. I have one individual that's disposing of her waste in garbage bags and taking it to gas stations. This is the kind of situation we're facing. And between mental health, DSS, law enforcement, I'm having a lot of problems trying to get these people help. And that's what I'm really excited about, that maybe on a state level, and like you said, Commissioner, collaborating with other counties, I can get some answers on how to help these people. So that's why I joined.
No, thank you, Commissioner.
Thank you.
I think, there's a whole range of issue areas that we could focus on here, right? And I think our biggest struggle moving forward will likely be finding that focus. I think that's always one of the hardest things to do, because there's just a variety of areas to focus on. Commissioner Kafalis, I want to come back to you. I think obviously Larimer County has one of the most well-established livable community age-friendly initiatives in the state. I think we are very lucky to have Partnership for Age-Friendly Communities as kind of a best practice and kind of guiding example for a lot of the work that we do. And I just wanted to ask you if you would speak a little bit to some of the projects I know that you're engaged in with them around housing, other issue areas, but things you're excited about happening in your community that might be replicable across the state.
Again, thank you, Jared. And I'll probably have to leave it about 2:40 because I'm actually going to a skilled nursing facility to meet with the resident council. So I think that's an example of how we need to be out in the community. And I think that speaks to one of the questions that will follow. And I appreciate Commissioner Thompson from Saguache. That's a very interesting reality that you just shared. We have people experiencing homelessness who will live in their campers, and they're often not up to code, and they're not doing a very good job of staying healthy. So it's good to understand that from your perspective. But to your question, Jared, a couple of initiatives that I'll highlight, and certainly affordable housing is a big issue that is part of our 5-year strategic plan. And just recently, we had recommendations from we now have a housing stability program manager, and we are looking at those recommendations which are about creating affordable housing, preserving affordable housing, and also supporting initiatives that are already in place. I think a foundational thing is this idea that we want to give people, older adults in particular, choices, and the idea of aging in place and the built environment, and how can we make it easier for folks to age in place with a variety of tools. So affordable housing is a really critical initiative that we are advancing. And that is everything from making sure that we are working with folks who live in manufactured housing communities, mobile home parks. We recently, just in the summertime, we directed $1 million of ARPA funding to help a mobile home park become a resident-owned community in terms of a unique relationship that they had there. So housing is a big piece. A couple of other things that I'll highlight, and I hope that's helpful to folks. And I'm happy to follow up with Commissioner Thompson if that is useful. But we also were behind legislation that passed regarding alternative response initiative legislation, and we will be one of the counties that are piloting this. And the idea is that when in the adult protective services world, if there is a concern that somebody references, there's a way of assessing that concern, the risk level, and then determining, is it something that would require full-fledged investigation, or is it something like we do in the child welfare, child protection world, that would require reaching out to the older adult and helping with resources. So the alternative response pilot is a really important initiative. Another thing is we are looking at updating our 4-year Office on Aging strategic plan. And related to that, we are working with the Colorado State University Center for Public Deliberation to convene a bunch of meetings so we can get that, so we can get that community input from folks on what we should be doing in the next 4 years. We are utilizing ARPA funds and to do another outreach position, through our Office on Aging, to conduct outreach to folks and families across the county to make sure that they're aware of the various services. We have an adult protective services prevention specialist. Again, we're using some of the ARPA funds. And then finally, we're partnering with CSU, Colorado State University School Social Work Research Center on a project to evaluate the outcomes and impact of the services that we're providing to older adults. So there are a variety of initiatives. Housing is front and center, and certainly we recognize that there are issues that people who live in urban areas are very different than people who live in rural areas. And it's one of the ways that we're trying to address the issues related to folks who are rural areas. We have a broadband strategic plan, and we are looking to provide service, high-speed internet, throughout the county. But of course, that's a multi-year project. And especially with all in the mountainous areas, with all the wildfires, we are doing a lot of work around building resiliency and getting, community-based groups to work together to support one another. Thank you. That's a mouthful.
Thank you, Commissioner Kofalis, and I appreciate you joining today, and understand, glad to hear that you're going out into the community and spending some time in those residential care settings. I really like kind of those examples you shared there, because you're able to highlight some of the key focused local initiatives that you have underway, but then also some of the broader state systemic impacts that PAFC and Larimer County has been able to have. And I think through that Adult Protective Services Alternative Response Pilot Program that the Department of Human Services will be launching, that was really born out of local adult protective services agencies coming together that worked closely with child protective services and seeing something that worked well in that child protective space, and then coordinating and bringing that up to the state level and driving that. So I think that's a wonderful example of how these kind of local initiatives and local coordination can bubble up vertically into broader systemic impact. And I think it works horizontally, working within your cities and your towns and your counties, but then again, there's also opportunity for state level impact. Commissioner Thompson, I want to turn to you. Commissioner Fox mentioned at the end there, kind of the rural-urban difference in Colorado. Rural looks different all across Colorado too, right? Eastern Plains is not the same as the mountains. Mountains not the same as the Western Slope. I think being a representative from rural Colorado, Commissioner Thompson, can you speak a little bit about the value that having engaged volunteers, engaged people locally to help coordinate and help bring those people together, how that can support elected officials in your work?
Well, that's what I would like to do, right? At the present time, we really don't have a lot of support groups. Like Commissioner Kafalis was saying, we have DSS and I'm on the South Central Senior Board, but as far as Saguache County itself, we really don't have a lot. And that's what I'd like to see. And as a commissioner, try to create more
And I think,
committees or, you know, people to engage and help our elderly. Because it's getting really, really bad,
and
the way these
you know,
people are moving.
I think one of the valuable things that we can certainly spend more time talking about this intentionally is how do we identify those community leaders that really can drive that. And I think let's be kind of thought partners in how we go about that in your county and in your region.
Thank you.
then-
That's what I would like that.
Yeah. And then Commissioner Child, wanted to ask you, I know Pitkin County and as I mentioned, the city of Carbondale, and then also Eagle County Public Health have kind of been coordinating together on age-friendly livable community work. And Commissioner, I wanted to give you the opportunity if there were any initiatives or takeaways that you're proud of that you want to share kind of with this group around a lot of that work that's been driven out of your region and out of your county.
Well, we certainly have a tremendous awareness of aging issues in the Roaring Fork Valley with Garfield, Southwest Eagle County and Pitkin County working, you know, pretty darn closely together on, you know, joint efforts for events. And we expect that will continue. In Pitkin County, we have a funny situation where we are one of the 10 healthiest counties in the whole United States. I think along with Summit County and maybe Douglas County and a few other counties in Colorado are also in the top 10. We have a lot of seniors who we never see them coming to the senior center because they don't consider themselves to be aging Americans. They're very healthy. They're active. They are still going skiing and hiking and bicycling and doing all sorts of activities. And they don't consider themselves to be part of the aging older population. The people we get at the senior center are those who really are looking for more help from just the socialization at the senior center. They maybe don't have as many friends in their circle. They maybe are lower income, and so they can benefit from the subsidized meals at the senior center, those sorts of things. Another problem we have at our senior center is that it is attached to an assisted living facility. And so a lot of people think that they don't want to go to the senior center because it's a place where old people go to die, basically, at the assisted living. So we are working to develop a new senior center at the recreation center which is owned by the city of Aspen. And there are examples across the state of different community centers that have the senior center, and some of them have a library and the recreation center and all these different things at one location. That to me would be the kind of a location. A lot of the older people are already going to the rec center for their workouts and to go swimming and to play hockey. Some of them, all sorts of activities. They're very physically active. By having the senior center at that location, I think we would probably draw a lot more people into our activities at the senior center. We also have trouble even getting people to volunteer to be on the senior council because we have so much activism in our county with people working on all sorts of initiatives on a local, state, and international level, really. There are people working all around the world who live in Pitkin County. And so there's no shortage of volunteer possibilities for people without volunteering to be on the senior council. So it's kind of frustrating that we have this very important effort going on, and everybody is aging, and they're all going to get there sometime that they're going to realize they maybe could benefit from some of these services, but they don't think they are there yet. And so we have a little bit of, I guess, an identity crisis here for our senior council and the senior center.
Yeah, I think that's a fair point, Commissioner. I mean, I think, you know, I'm 35 and I spend a lot of time thinking and talking about this stuff. And it's like we're planning for our future, friends. Like we're all going to get there. So let's be intentional. Let's put our heads down and let's focus on this and not act like it's something that we can just push down the line. And I think that intergenerational focus that Rachel pointed out in the chat is great. It makes so much sense. And there's so much untapped potential. I mean, older adults are already such a valuable resource in kind of our volunteerism space. But then, I mean, also in going back into paid labor, we know all the job shortages and work issues that we're having right now. And I think we're trying to be intentional about re-engaging retirees and healthcare for clinical opportunities, et cetera. That's just one example, but there's so much opportunity to kind of for mentorship. I know I have benefited greatly from being able to work with you and really others on this call over the years as kind of try to absorb and learn from a lot of that experience. So I think I know I want to kind of get us back on time track, Rachel, but I do want to ask Commissioner Thompson and Commissioner Child if you have any kind of closing comments, top line, parting words of wisdom, or just an ask to the group. I want to give you that opportunity before we shift back.
I just want to thank you all. You've given me some really good ideas. We have one adult protective caseworker and that's it. And that's why I think everyone's falling through the cracks. So just more groups getting involved. And our senior center is connected to the Department of Social Services. So that's why we don't have an actual senior center. But I'm really excited to meet with some of you and go pursue my dream to help my elderly people in my community.
Thanks, Commissioner.
Thank you.
One thing I would like to see is to continue engaging rural parts of Colorado in this whole effort. There are certainly communication issues, and the broadband initiatives across the state are helping tremendously, but then a lot of the older people are not technologically savvy and they don't necessarily want to learn how to get onto Zoom calls and whatnot. But the more we can engage people across the state in these efforts, I think that's important. One thing that was very effective that SAPCA did during our tenure was to hold the listening sessions in different areas of the state. And I would like to see those type of listening sessions continue. And they probably would probably be through the Colorado Commission on Aging would be the one maybe holding those meetings, but it's a good way to engage in those small towns across Colorado and give people the opportunity to have their voices heard. And also I hope that we can continue having Zoom meetings and hybrid meetings, but I have one ask for the hybrid meetings. Oftentimes when there are people in a room speaking, maybe they don't have a microphone right in front of them. There's just one central microphone and their voices are hard to hear. Unless it's someone on a Zoom call where everybody's on the Zoom, you can hear everybody fine. But I always, even wearing my headphones, which I consider them to be my substitute for my hearing aids when I'm in a Zoom meeting, I can hear really well. Unless it's a hybrid meeting and someone's far away from the microphone, and then I might as well save my time and not even be at the meeting. So just going forward, if we can all remember that, to make sure people can hear. As you get older and you start losing your hearing and sometimes your eyesight and different things, anything we can do to help older Coloradans, we need to do that. Thank you. And I really appreciate the opportunity to get to speak with this group today.
thank you, Commissioner Child, and thank you, Commissioner Thompson, for taking the time. We really do appreciate it. And Commissioner Child, I've been grateful to work with you over the years and continue to look forward to that. And Commissioner Thompson, I'm looking forward to working with you as we move forward. And I think that's a good plug there, Steve, around the value that those listening sessions brought. And I feel like every time we were, whether or not we were in La Junta or the Western Slope, like, you know, I think Commissioner Thompson, to your point, there was always someone popping their hand up in the room and saying, I can help you do that. I can help with that. I know someone that can do that. So it was a great space to kind of build some of that collaborative power. So let's talk more about that. So I will stop my rambling here and pass it back over to Rachel.
Thank you, Jared, and thank you, commissioners, for your time and for your input. I can already see in the chat, there's a lot that's resonating here, and I think that's really wonderful. I also want to circle back to that accessibility comment, Commissioner Child, that you just made. And this goes to kind of the heart of age friendly. We're talking about places to grow up and grow older. A lot of what we're talking about with accessibility isn't necessarily age specific. So in any of our gatherings, we never know, right? If someone does have a hearing deficit or potentially vision as well. And so it's a good thing, good practice for us all to keep in mind is having microphones at every single type of gathering that are accessible too. We don't have to get up and go to them. And the same thing with our visuals, making sure that we are taking into account that there's a lot of different needs and there may not be super obvious. And so this is part of making our spaces in person or virtual accessible to everyone. So I thank you for bringing that up. Right now, we're going to shift into hearing from the Partnership for Age-Friendly Communities in Larimer County. Corey Schmidt and Anna Rose Cunningham are now going to share with us one of the tactics. Remember, we talked about we're going to get into tactics and tools today. So they're going to share with us about a mobility assessment tool that they created and then how they implemented it. So this is another big how. Please, as always, throw stuff in the chat. I see that people are using the Jamboard, so keep that going. This is just a great opportunity to ask, how did you do that? How did you get around any of these barriers or challenges? So Corey and Anna Rose, I hand it over to you guys.
Thank you, Rachel, for the invitation to have Anna Rose and I speak with you all today. Go ahead and share my screen. I'm Corey Schmidt. I'm the mobility manager at the North Front Range Metropolitan Planning Organization, but we do work very closely with the Partnership for Age-Friendly Communities, and they were a key partner in this project that we'll be discussing today.
And I am Anna Rose Cunningham. I am a transportation planner at the North Front Range Metropolitan Planning Organization. So before we get into it, wanted to just, for anybody who is who does not know what the North Front Range Metropolitan Planning Organization is, we are a regional transportation and air quality planning agency serving Northern Colorado. We have 15 member agencies from Fort Collins, Greeley, and down to Berthoud and all the smaller towns in between, as well as serving parts of Larimer and Weld County. Out of our office, we also run our mobility program, Ride NoCo, which serves all of Larimer and Weld counties. So speaking of the mobility assessment tool that Rachel had mentioned, earlier this year, we developed what we call the Bike and Ped Safety Reporter tool. And so this was a recommendation that came out of our active transportation plan that we passed in 2021 to be able to understand the what safety looks like in our region before a crash occurs. So a lot of the time when we look at safety as far as, you know, roadway safety and things like that, it is really just retroactively. So wanted to be able to proactively understand where there are safety issues. So where there might be what you would call like near misses. So bad interactions between people who are walking, biking, or rolling and and drivers or motorists. So when there might not have been a crash that actually occurred, but it still contributes to an unsafe environment, or what might feel like an unsafe environment. So to be able to gather that information, we developed this crowdsourced online tool where members of the public are able to go onto the tool online and pinpoint on a map where there might be some accessibility issues, infrastructure issues, or where those interactions between motorists and people who are walking or biking are occurring. If you're interested in viewing the tool, I do have the QR code on the screen there, so you're able to scan that with your phone to be able to poke around within that tool. So over the last several months, we've worked with our safety data working group. So that's people who work with safety in our member communities, helping give input into this tool. We worked with our mobility committees in both Larimer and Weld County, as well as our community advisory committee, to develop this tool and to see what kind of information we're hoping to get from that, and to really refine it to our region specifically. If you could go to the next slide. And so what this tool does is it allows, like I said, for people to pinpoint on a map any kind of issue that they see. And there's a list of a variety of different issues or hazards that you might be able to report. And so things like accessibility issues, unsafe crossings, missing crossing, or like crosswalks, things like that, that might prevent people from choosing to use active transportation modes. So like biking, walking, or rolling, to be able to pinpoint on a map where those issues are. And so then we can work with our local agencies to be able to see what can be done about those different infrastructure issues. The tool includes both that online reporter and also a dashboard, so people can go and look and see, follow along as a report goes through the whole process. And one of the things that we had found would be a great use case for this tool is for the mobility assessments or walk audits that we have done in our region. And so now I'll hand it over to Corey to talk about those walk audits.
Yeah, we discovered, after working on this tool, that having a crowdsourced in the palm of your hand tool to submit data about your experience in the built environment had a perfect use case in conducting mobility assessments around your community, but whether formal or informal. But for those that aren't familiar with the term a walk audit, the nonprofit America Walks really spells it out simply. A walk audit is simply an assessment of the pedestrian safety, accessibility, and comfort of a particular area. Our partners up in Northern Colorado have been trying to brainstorm more inclusive words for these audits, such as pedestrian audits, mobility assessments, or mobility audits, just to be aware of the fact that not everyone that moves through our built environments are doing so on their own 2 feet. And we need to be inclusive of all the users of our communities while in the built environment. So kind of that first big use case for the Bike and Ped Safety Reporter tool happened in June when we worked with the Mobility and Access Priority Group of PAFC to host a walk audit in the Foothills Mall in Midtown Fort Collins corridor. We chose, members of the group chose this corridor due to planned streetscapes enhancements coming down the pipe. And we had over 20 participants across various public and private agencies. And the question that we posed when embarking on this assessment was, how do we ensure that these improvements that are being planned at the engineering and design level right now consider access for people of all ages and all abilities when being completed? So our participants split out into 6 groups to explore the Midtown Fort Collins corridor. We assessed things such as sidewalks, crosswalks and street crossings, connections to transit stops, as well as wayfinding signage to get people to destinations in the area. It just so happened kind of randomly that we had various mixes of professional disciplines among our 6 groups, which we heard from multiple groups yielded really strong discussion and insights, because we had the assistant traffic engineer of Fort Collins side by side with a public, health educator. So those 2 folks are looking at the environment and through very 2 different lenses, but we're able to really find some common ground and understanding, and really see how all these different factors influence the safety and comfort of moving around our built environment. So we found, so through that report we received, or through the assessment, we received 95 individual reports into the Bike and Ped Safety Reporter tool over that 2-hour walk assessment period. And here's some of the key findings that we found. We found that the frontage roads along the US 287 and College Avenue corridor were unsafe and unpleasant for pedestrians. Wayfinding came up as an area for improvement throughout the entire district. And the lack of pedestrian refuge islands really made it difficult for people of all ages and abilities to safely cross. For those that are unfamiliar with Fort Collins, through this section of town, College Avenue is 6 lanes wide in most sections. And even participants, all being able-bodied, had troubles crossing the street in the time that we were given through the walk count tracker. And then lastly, a comment that was found was that the vehicle volume and speed along these arterials also made it difficult to hear those audible pedestrian signals, which could really present some safety challenges for people with visual impairments. So through that work, gathering and synthesizing everyone's reports, notes, comments, and suggestions, we kind of came up with 4 kind of overarching recommendations that we passed on to stakeholders, including the city of Fort Collins. One was the recommendation to convert our frontage roads to one-way to vehicle traffic and use that freed up right-of-way to expand pedestrian bicycle infrastructure. As I mentioned, installing pedestrian refuge islands at the intersections along the corridor came up often. Installing high visibility crosswalks at all intersections to enhance safety. And then in working with businesses to ensure that commercially owned property is accessible and ADA compliant. Moving forward from the success of this June walk audit, the Fort Collins Senior Advisory Board passed a resolution endorsing the recommendations from this report and passed it along to City Council. And then we are also starting to begin work with PAFC, the Larimer County Department of Health and Environment's Built Environment team, the City of Fort Collins, and other partners to create some kind of mobility audit ambassador program with this vision of, it's great that we can come together once or twice a year to hold these walk audits in our communities, but how can we create a team of volunteers that can go out there and assess their communities and their homes more frequently? So whether that's through train-the-trainer opportunities or engaging neighborhood groups to utilize the tool and educating them. We've also been discussing at our mobility committees and mobility and access priority meetings, different avenues of incorporating the feedback of older adults and individuals with disabilities who may not be comfortable using a phone-based QR code-based tool. So we've started shopping some ideas such as open houses and workshops. So we could really still incorporate those experiences and those comments on the built environment without putting the onus on the user to actually have to learn the technology to, in order for us to intake that data and pass it along to our local jurisdictions. And then lastly, the MPO plans to continue facilitating these assessments across the region in partnership with other community organizations, with a focus on that access for all ages and all abilities. And I will drop the link in the chat to the ArcGIS story map of the walk audit that goes into much greater detail about the event and kind of the findings for those that are interested. And then I'll hand it off to Anna Rose to close up, kind of talking about how your own community or own agency could incorporate this tool.
So I wanted to just talk briefly about the creation of this Bike and Ped Safety Reporter tool. We are a pretty small agency, and so we don't have a lot of technical staff. So to be able to build this from scratch would have been a pretty big take for us. And so one of the things that is really great is that Esri or ArcGIS Online has these set of like a suite of tools that they call ArcGIS solutions. So they've already created these types of online tools for like local governments to be able to launch. And so the one that we used to create the Bike and Ped Safety Reporter tool was within their Vision Zero ArcGIS solution. And as a transportation planning agency, we already have like just a standard license to ArcGIS or Esri products. And so it's just included with that. And so they had already built out this tool that you can just launch and just customize to your needs. And so we did do several different customizations just to make it exactly what we wanted it to be. But it was a pretty easy tool to be able to launch and set up. And in addition to the reporter and the dashboard, like I mentioned, there's a way to like look at it from the back end as the manager of it, to be able to like manage the data that comes in. So it's been really great to be able to use this tool without having to, build it all from scratch. And if anybody has any more specifics about how we built the tool or things like that, I'm definitely available to talk about that with anybody who's interested.
And that's all we have prepared for you this afternoon. Thank you.
Well, thank you both for that. And I think you really embodied several of our themes right there. The creativity, the intentionality, really going for something that can be simple, yet really give you a whole lot of information and lead to some real change. And so thank you both. We will be making the recording of this available, so you'll be able to have if anybody's quickly taking notes, you'll also have access to those slides and the links as well. So that'll be coming out after this. So thank you both for being with us today. If anybody's got other questions, please feel free to drop them in the chat. Right now, I'm going to actually turn it over to our final speaker for the day, Andrea Karlstrom. Sorry, Andrea, butchered your last name there. Who's the director of the Chaffee County Public Health Department. And she's going to share more with us about their efforts all around age-friendly. So off to you.
Thank you. And Rachel, don't worry, it happens all the time. It's a tongue twister, especially if you're from New England like I am. I just want to say thanks everyone for the opportunity to quickly present today. I'm looking at the clock and really want to be respectful of everyone's time and just to follow such inspiring guests. So I was taking notes myself, just getting really energized about some of these creative and innovative ideas. So why public health, and how are we here today to just chat with you about what we have had going on in Chaffee County Public Health? So what you may not know, our commissioners on this Zoom do know, but local public health agencies are governed by local boards of health, which oftentimes are our county commissioners, at least in most counties. And I think, just in listening to our commissioners speak this afternoon, it is essential to succeed in the work that we do to have the support of elected officials. And so I'm really glad that this has been a kind of collaborative panel this afternoon. I've been very fortunate to have amazing county commissioners and supportive Board of Health for the last 7.5 years in my role as Director of Public Health here. And so at a minimum, local public health agencies are required to conduct a community health assessment every 5 years. And then to follow that, a 5-year improvement plan. It used to be called the Public Health Assessment and Improvement Plan. We've broadened it, and I think most counties have broadened it to the county's Health Assessment and Improvement Plan. And in 2016, we're seeing an interesting shift in our demographics, in which at that time, 1 in 5 Chaffee County residents was 65 and older. And it was predicted that by 2018, 1 in 4 would be 65 and older. We actually hit that milestone in 2017. So we here in Chaffee County do have an aging population, both of those who have decided to make Chaffee their either vacation or their seasonal home or just their retirement destination, but also those who are multi-generational and who have been born and raised here and have such pride in our beloved valley. And so through that assessment, we prioritize the needs of older adults here in our county to try to get ahead of the curve, to try to be as proactive and thoughtful and strategic as possible, so that when those individuals and households are finding themselves aging, which I always appreciate the term aging so cool, everyone's doing it. I think that just goes to the spirit of this particular group here this afternoon. We all should be thinking about what that next chapter in our lives is. And in our role as chief health strategists in our local public health agencies, what we're really doing is to pave the way for that next chapter, to have the services and supports ready for later in life. And so it's been an incredible journey. We formed an Aging Well group of champions somewhere, I think it was probably in late 2018, early 2019, that I kind of assigned to help create a deeper dive into the needs of older adults in our county. I mean, it's great to say that we need to prioritize this, but how do we put a plan into action? And so we had a great group of about 10, 12 individuals, both professional and people from our community, that wanted to roll up their sleeves and to figure out how to build a coalition that would take a deeper dive into this data. And so when we did that, and that was at the end of 2019, beginning of 2020, the four top priorities that really rose to the top were aging in place, social connection and support, recreation opportunities, and one that I don't think we've covered today here, financial support. Really looking at the cost of living here in our county, the cost of healthcare and healthcare coverage, and also just looking at how we can remove financial barriers for our older adults to participate in activities, especially those who have lived in the county the longest. And so I think we have in some way, shape, or form touched upon those priorities in the past presentations. And then along came COVID-19. So for us here in Chaffee County, that was in March of 2020, in which our public health world got seriously rocked, as well as many sectors in our community and of course in our society. And so while there has been significant turnover in other local public health agencies, in local public health leadership, state public health leadership, we have weathered the storm here in Chaffee County. And despite the pandemic and our role as incident command, we've actually created an Aging Well program here in the county. Our county is quite ambitious, and so they were not going to let a pandemic get in the way of us creating an Aging Well program. So I'm really calling this stage of where we're at with the pandemic as the Great Reconnection, because there's been a lot of turnover, because there's been a lot of new programming created. We have an opportunity to dust off our sleeves and really get to know each other once again, or for the first time for that matter. And I think it is a really exciting time for the aging landscape, as well as other public health programming. So we are flexible and nimble enough. Usually there's a grant for whatever we're looking to develop to create creative programming. We have secured several funds through the Next 50 initiative, through the Colorado Department of Public Health and Environment, and other funders who really see the need for this work and trust that local public health agencies and their partners are being the best stewards of the funding and moving the needle in the right direction. And so I just count my lucky stars that people still want to work for public health. And we were able to hire an Aging Well coordinator. She has been in her position for a little over a year with my agency. She started out with a local nonprofit that was kind of working as a safety net for the needs of older adults in our community called Sage Generation, in which I was a member of the board of directors on. That kind of disbanded, and we kind of assumed that coordinator role. And that coordinator oversees our Age Strong Coalition, which I think is very similar to some of the other coalitions that are on our Zoom today, as well as several new key programming elements that we're really excited about, especially those that address the kind of the social isolation part of our assessment, as well as physical activity, yearning just for more opportunities to improve health. And so we started game day on both ends of our county. And so for those of you who don't know our county, that's Salida and Buena Vista. Game day for older adults, that happens weekly. Yoga for older adults, that is insanely popular. We've had to think about maybe adding a few more classes. So that is just a wonderful thing to see. And we also have our Embracing Aging education series, and we just held for the first year in what I think 3 or 4 years, our Aging Expo. And so that brought together over 200 older adults from our community, their friends, their supports, lots of different agencies serving the needs of older adults. We had activities and sessions, and it was just a good old-fashioned health fair times 10. And so that was really encouraging to see. And then at a minimum, we offer quarterly education opportunities. It's just a series of interesting topics that pop up that we want to offer to our older adults. We've also adopted changing the narrative and have brought that to our healthcare partners and community stakeholders. I've learned a lot from changing the narrative, and they really encourage any of you to check that out, bring it to your communities if you haven't already. I just love that it's simple, but gets you thinking, and really does change the way that we think about aging in our communities. And one other kind of zany activity event that we planned that sounded kind of offbeat to begin with, but then as it started, the planning started happening, we really saw this vision of what we called Techie Taco Tuesday. And Techie Taco Tuesday brings together younger people, those who are in generally school aged, with our older adult population to work on a technological device. It can be an iPad, it can be a laptop, it can be a cell phone. And so that was really well attended. Our local community center allowed us to use the center for free. We were able to whip up food for a very nominal cost, and it really touched the lives of our older adults. So we really hope to bring more of those kind of innovative intergenerational events to our community. As Rachel mentioned earlier, home share, we have also launched a home share program in coordination and collaboration with our Chaffee Housing Authority. So they're going through their own evolution and growth in our community. And so they said, well, hey, we partner with public health quite frequently. If you wouldn't mind taking the lead on home share, we can focus on a few other things. And then we can, kind of cross-pollinate our expertise. And so that has been just amazing. I saw Allison on the Zoom earlier. We've been receiving technical assistance from Sunshine Home Share. And I believe my home share coordinator is meeting with our first potential home provider in our county yet. So keeping my fingers crossed that it's successful. Once we get some home providers, so older adults that have space in their home for exchange for light housework and or other sort of duties, we're going to advertise this program pretty heavily to address our affordable housing issues in our county, specifically related to our lack of workforce housing. Going to have a lot of people signing up to at least apply for our home share program. And again, that has a potential for intergenerational cross-pollination and relationship building as well. We are a seasonal community. We have some folks that, work on the river in the summer and on the mountain on the winter. And so this may be a great way to bring just those perspectives together and to touch the lives of our younger people and our older people in our community. And we also just recently absorbed a local nonprofit, Ark Valley Helping Hands. It's has previously been a nonprofit that pairs up older adult members with volunteers in our community for various tasks, mainly yard work and snow shoveling, but also transportation to medical appointments and that kind of thing. We were in our small community. Sometimes it's hard for these nonprofits to take off and to become strong and viable. And so we, as local public health, just have taken these groups under our wings and have created new programming under public health so that they have the backbone and the administrative support, that they have access to other public health programming, and that there truly is no wrong door. So they enter public health from one door, but they also gain services through a myriad of different programs, whether we're talking about, diabetes prevention or oral health screenings and that kind of thing. So it's just really cool to see kind of this three-pronged approach. We have sort of age strong and embracing aging, which is more of our activities and events and community outreach. We have our home share, and then that third leg is Ark Valley Helping Hands. We have our seasonal Saturday this Saturday, in which we have all sorts of volunteers. They don't have to be official volunteers coming to meet up, to get assigned to various households to mainly do yard work this time around. And then we have a celebration afterward to celebrate our volunteers, to celebrate aging in our community. We hope that through Ark Valley Helping Hands, we can actually expand the programming to include something more intergenerational. We're not there yet, but Service Saturday does solicit a lot of community groups. The last Service Saturday, the high school basketball coach said that all of the teammates had to participate in Service Saturday or they wouldn't get something. I can't remember what it was, some sort of milestone that they were about to celebrate. And so they all showed up, rolled up their sleeves, and it was just really cool to see everyone working on behalf of older adults in our community. And we're also an age-friendly community. That has been really neat. It's just opened a few doors that we wouldn't have had open to us in the past. And, I think in our communities, the value of public health, while we're kind of like the silent behind the scenes prevention folks, we're definitely more than just giving out shots, believe it or not. But I think our role is evolving so that we, can lead, we can convene, we can empower, encourage, communicate. We're kind of the center of a Venn diagram in a lot of this work, and we have our hands in a lot of different initiatives and projects. And I think, we can help these grassroots efforts by being a backbone and administrative support, but hopefully empowering them so that one day they can, get their legs underneath them and really be their own entity and really, especially for this conversation, just continue to fight for the needs and the resources we need to support aging in our communities. We have a lot of funding that goes into maternal and family health. We have fantastic funding for schools and school programming, but I think sometimes, at least historically, we've forgotten about our older generation. And like we've said a couple times, we're all going to be there one day if we're not already. So thanks for having me.
Thank you, Andrea. That was great. There's a lot going on, not only in Chaffee County, but I see, I agree with Kiva's comment too in the chat, but really across our state and beyond. And so thank you so much for being here today and for sharing that with us. I know we have about 6 minutes left in our time together. So I want to just mention a couple quick things, and then if anybody's got questions or comments, please throw them in the chat. We'll probably have time for maybe like one group question. But real quick, just wanted to point out that I put a link in the chat for just a very quick feedback survey. If you wouldn't mind, just take a few minutes. It shouldn't take you more than 4, just to fill it out. We really do use the feedback. And we are looking for what folks are interested in for the next topics. We've got a running list. It's growing quickly, but we really do want to hear from all of you. Also, we didn't have time today to play. We have a video from Carbondale talking about what they're doing there. So when we'll send a follow-up email out with the recording of this webinar. We'll also be sending that video as well. So any questions? I noticed that we've got one post-it went into the Jamboard around some of the barriers or challenges, but anything that's on your mind, you either want to get some input on or just want to reflect on something that you heard today. I know we heard a lot today. Well, you are always welcome to send an email to either Jared or I. We will put our email addresses in the chat. If you do have questions afterwards, we are looking to keep this going. And yes, it is a lot to process, Kiva. There's always a lot of information that we're providing. But we did find after the first webinar that there is interest in folks coming together, being able to continue sharing what's going on, being able to start problem solving. And so Jarrett and I are definitely in conversation about how to build that into the Lifelong Colorado initiative, which is what there's lots of different names for age friendly. That's one of the names across the state. So as long as you're connected, as long as we have your information, we'll definitely keep you updated on all of that. We've found, especially in the intergenerational programming world, some of the greatest benefit is networking with each other and being able to say, hey, you know, just like Andrea was talking about with their technology program, we're trying to do this, but how do we get there? We've just hit this particular barrier. Through the Linkages Collaborative, we actually come together and problem solve. Everybody's got a lot of different experience and resources, and it's the same across the age-friendly universe. I would recommend too, if you are interested in more information on intergenerational programming and other resources, check out the Linkages Colorado website. We're actually building a whole new website and online dynamic hub that's going to have a ton more resources, different toolkits, and we already have a bunch of videos on evaluation and how to make space for intergenerational connections, but there's a lot more coming there. We just want to make it easier for everyone and remove those barriers. So if there are no questions right now, Jared, did you want to say something? I know you just came off of mute.
Yeah, I just wanted to offer a couple of closing comments. And I think another just resource list, I'm going to put a link to AARP Global Communities Network in the chat. And there's just, I mean, Rachel and I talk about this all the time. You know, we're not looking to recreate resources here. There's so much out there. It's just about kind of sharing and getting it out there and making folks aware of what is available. But I think, you know, moving forward, would really love to likely move to some sort of cadence here that allows for folks to come together and share best practices and examples. And perhaps that's in a less structured format. Perhaps there are maybe there's one structured presentation, but I think really want to capture your feedback on what would be valuable as we move forward. I think the goal with some of these conversations has been to reach folks who are and who are not involved in age-friendly community work, but we also have age-friendly public health initiatives and age-friendly university initiatives and age-friendly health systems initiatives. And so there's all these different systems levels focusing on aging and older adults. And it's part of kind of my responsibility through Lifelong Colorado to make sure that we're linking all those pieces together. And I think I'm very fortunate to have know so many of you on this call and to have kind of our next steps with our Colorado Commission on Aging as a very intentional space to link all those pieces together. So I think we've been, for those who have been around this work for a little while, you know, we've been kind of working on this for years, but we're still at the beginning of it, it seems like. So, but I think we continue to gain momentum and take steps in the right direction, even if those steps might be kind of small sometimes. But I just appreciate all of you and your time. So I just wanted to say thank you.
Well, thank you, everybody. It is 30 after, so we release you. We'll be sending out the recording, but thanks again for being with us, and thank you to all of our speakers today. Take care.
Thank you all. Thank you, Rachel.
Bye.
Thank you, Jared.